like your apobicin, neomycin, in powder form. That's number one. Number two is that um, at what point do you give up on a wound? Is it possible for you to have somebody presenting with a wound and you look at it and say, no, this wound can never heal? Is there anything like that? So thank you. Almost every wound heal. Thank you.
Yes, sir. Thank you, Dr. Guderewu, for this wonderful lecture. It's very educative. Yeah, I just have a few questions for you. Number one, in those days, there is a school of thought that when you have a chronic wound, at a point, you don't use any other thing to dress that wound other than normal saline. That at a point, maybe after some weeks, like this 6 weeks and that kind. And I've worked with us that they don't use any other thing other than normal saline. Thing under investigation, when you are listing the investigation, serum protein is there. I'm just interested. I want to know more about that. Then this ankle breaker pressure index and how we can do that in rural area here. Well, you've thought of the importance of hydration, because I saw it there under treatment. I mean, importance of hydration. You talk of hydration. I mean, so later when you are discussing that the wound should be moist and that kind. So I think I got that. The other one is, all right, I think Dr. Gushina asks, there with that. When you are talking of gangue, which is very difficult, at least to get the imported one, we can use common pad. And I don't know if you know about that and you want to tell us more. Thank you very much.
Thank you, sir. Any other question? Sorry.
Thank you, sir, for the presentation. I have a clarification to make. When you mentioned that we should not use honey on a bone-exposed wound, I didn't hear what reason you gave for not using honey. And another question is that what's the best approach in treating a chronic wound on a tendon, for example on the Achilles tendon? And then the last one is the best approach to treating a bone exposed wound. Thank you, sir.
I'm sorry, somebody has asked this. I went out on an assignment. Is there any of our locally available food item that has recognized ability in wound healing?
Any other question?
Sir, any of our locally available food item which, if you are consuming it more, can benefit you if you have a chronic ulcer?
Thank you, sir. Part of the problem of chronicity in wound healing is, you mentioned uremia. How do we handle the problem of uremia to solve the problem of chronicity?
Any other question? Okay.
I said part of what causes chronicity in wound healing is uremia. How do we handle that problem? Yes. To promote wound healing.
Thank you, sir. I just want to add, as part of other supportive management, like tetanus prophylaxis, is it because we are talking of a chronic wound? Does it not have a place in chronic wound?
Can you get? Oh, go on.
So, other supportive management, tetanus prophylaxis. Yes.
What is the place of tetanus prophylaxis? Okay.
Okay. Thank you very much for that wonderful presentation. I want to ask, you mentioned the use of Daflon.
I suppose that means a tablet. At least what I know about Daflon is peculiar to hemorrhoids. So I want to emphasize that in terms of wound healing, Daflon. Now the second thing, my second question is, you said the use of hydrogen peroxide and Uzol is no longer, is it prohibited, is it no, or there are some conditions that can still be used, or it is no, and if that is the case, what are the stepwise in a very synoptic way how to do it in these rural settings? If you have a wound, something that looks general, most of the time you use this and this at least, because these types looks enormous to us, and we now be figuring our head around what kind of wound is this, what should we use, is this do they have a convergence in such a way that we have materials, at least material that is common to most of them, in which we can use, in which we can, as in a stepwise way, in which all this wound might have a convergence, or if there is maybe for a little bit of differences that can help those of us in rural settings how we go about this wound healing. Thank you very much.
Any other question? So before I hand over the microphone to the presenter, I would like to ask this question. And it's about diabetic foot. Is there anything special in management of diabetic foot that distinguishes it from other chronic wound? Any special thing about management of diabetic foot?
Okay, thank you so much for the questions. Well, I'm actually expecting as much as this question after this presentation, because wound care is maybe a little bit confusing, and then there's a lot of background knowledge which may be different here and there. Now, thanks for I'll start by thanking for the I'll just go straight to the questions alone. Now, there's a question on the issue of rest. Yes, somewhere in this presentation, rest is there. Probably what you didn't recognize may be the cause of that chronicity. The cause of the chronicity, which you manage by the rest. Maybe edema, which may be from venous insufficiency. Patient will present with some subtle edema, and then some hyperpigmentations here and there. No matter how much they treat that wound, if the primary cause is not taken care of, the wound will not heal. And how did you take care of the cause? Maybe unknowingly now. You put the patient on the bed, edema disappears, wound is going to heal. Now, these days we may not be able to keep patients on the bed for so long anymore. One of those things that we can use is compression bandage. So you put patient, in fact, let them be walking whatever they want to walk. The more they walk, the more the pumping action of these muscles come, and the more the drainage they have. And then before you know it, the wound will heal under this dressing agent. And then pharmacological agent that can be used in that line is the Daflon. So I'll go to the question on Daflon. So Daflon is actually well, I won't say it's a new agent, but it's generally used for treatment of venous stasis. Okay, and then it helps with perivascular reduction of perivascular edema, which also is a problem in patients with venous wounds. So that is where Daflon then comes and become more useful. I know the use of Daflon goes beyond, in fact it's not popular with wound care, but it may be popular with hemorrhoids and the rest. The pathophysiology of the use is the same thing. Okay, but it can also be used in situation of venous ulcer. Now, X-ray, yes, X-ray is also very important, but you need to identify what may be the cause of the wound before requesting for the investigation. If we are suspecting a chronic osteomyelitis,